A senior in their mid-70s came to me. After 14 months of sciatica management, they had been given an exercise program by a previous provider. A good program, the right stretches, the right sequence, the right approach in theory, but they had stopped doing it after 3 weeks. Not because it was not helping, because getting down to the floor and back up again had become so difficult, and on 2 occasions so painful that the exercise itself had become a source of dread. Rather than relief, they had simply stopped, and their sciatica had continued, progressing without the exercise component that their recovery needed. I redesigned their entire exercise protocol around a single chair. Everything they needed, every stretch, every release, every nerve mobility. Exercise adapted to be performed, entirely seated, within 2 weeks of consistent daily practice. They were reporting consistent improvement in their morning pain scores for the first time in months. 6 weeks later, their average daily pain had declined from a consistent 5 to a consistent 2, 5, not because the chair stretches were magical, because they were actually being done consistently every single day, because the barrier that had been stopping them was gone. Tonight, the barrier is gone for every senior watching this video. Now, here's what you need to understand about why these 3 specific muscles are the ones being targeted and why releasing them specifically produces sciatic nerve relief that general stretching never achieves. Your sciatic nerve travels through a very specific anatomical pathway from the lumbar spine through the deep gluteal region down the back of the thigh to the foot. Along this pathway, 3 specific muscles are the primary culprits in sciatic nerve compression. The piriformis sitting directly over the nerve in the deep gluteal region. The psoas pulling the lumbar spine forward and narrowing the spaces through which the nerve roots exit. And the hip adductors, the inner thigh muscles whose chronic tightness creates pelvic rotation that places asymmetric tension on the sciatic nerve pathway. Most stretching routines address 1 or 2 of these. The 3 chair stretches tonight address all 3 in a specific sequence that releases the outer muscles first before addressing the deeper ones, maximizing the cumulative effect of each stretch on the one that follows. Let us get into all 3 right now. Chair stretch 1. Seat. Sit comfortably in a chair. Lift your right leg and place your right foot on top of your left thigh, just above your knee. Maintain an upright posture. For a greater stretch, begin to slowly lean forward with a straight spine. Hold this position for 20 to 30 seconds and slowly relax. Perform on both sides, approximately 2 to 3 times throughout. Inhaling for 4 counts, exhaling for 6. After 60 seconds, sit upright, uncross the ankle, and repeat on the left side. Now, here's why this specific seated version is more effective for seniors than the floor version, most physical. Therapists prescribe, stay with me, because this part surprises most people. When you perform the figure 4 stretch, lying on the floor, the hip is in a fixed position determined by the floor surface. You cannot adjust the angle. Stretch first. Seated figure 4, piriformis release. You cannot modify the depth, and getting into and out of the position requires hip mobility that many seniors with sciatica have already lost. The seated figure 4 allows you to control the depth of the stretch precisely, leaning forward more for a deeper release, less for a gentler one, and to adjust the ankle position moment by moment based on what your body tells you. This control produces a more effective and more consistent piriformis release than the floor version because it can be precisely calibrated to your specific anatomy and your specific pain. Presentation. The piriformis is the muscle most directly responsible for sciatic nerve compression in the deep gluteal region. When it releases, when it genuinely lets go after 60 seconds of sustained gentle stretch, the pressure it has been placing on the nerve reduces immediately. Most seniors who perform this stretch correctly for the first time report feeling something they describe as a release of pressure in the buttock and upper leg within the first 30 seconds. That sensation is the piriformis releasing its grip on the nerve. Hold the full 60 seconds to allow that release to go as deep as the muscle will allow. Chair stretch 2. Seated so. Release with chair support. Target so. Muscle time 60 seconds each side. This stretch requires you to sit sideways on the chair, 45-degree from your center. Small dumbbells or water bottles are a great height, but now we're going to lift our foot over and to the other side. Music, this will strengthen our hip flexors and open up that hip area. Now we're going to do the opposite and drop our knee inward, just like a hockey goalie making a save. Sit at the edge of your chair and control. Music, your movement, great for pelvis mobility. Now we need to focus on internal, external rotation. Lift your foot about 2 in from the ground and just like a pendulum, move your foot to the left and music, then to the right. You'll definitely feel it on the outside and the inside of your hips. Hold for 3 seconds. Music at each end. Switch sides. The psoas muscle runs from the lumbar vertebrae directly through the pelvis, and its chronic tightness in seniors who sit for extended periods creates 2 specific problems for the sciatic nerve. First, it pulls the lumbar spine forward into an exaggerated arch that narrows the spaces through which sciatic nerve roots exit the spine directly, increasing nerve root compression. Second, It creates mechanical proximity, pressure on the nerve as it passes through the pelvic region. Releasing the psoas addresses both simultaneously. The seated chair version of the SOS release achieves something that standing hip flexor stretches and floor lunges cannot. It isolates the psoas stretch while keeping the lumbar spine in a supported neutral position. Standing hip flexor stretches often produce lumbar arch compensation that reduces the SOIs. Stretch effectiveness, floor lunges require knee and hip mobility that many seniors with sciatica lack. The chair version removes both problems, providing a clean, isolated stretch from a completely supported position. Most seniors feel this stretch in a different location than they expected, rather than the obvious buttock sensation of the piriformis stretch. The psoas release produces a sensation deep in the front of the hip and sometimes extending into the lower abdomen on the stretch side. This deep front of hip sensation is exactly correct. It confirms that the psoas, the deep lumbar muscle driving the anterior spinal compression, is genuinely releasing. Hold the full 60 seconds on each side. Chair stretch. 3. Seated hypoductor release with nerve mobilization target. Hippoductors plus sciatic nerve mobility time. Repetitions, then 60-second hold. Sit upright on the chair with both feet flat on the floor. This is an easy nerve glide to do while you're traveling. So if you're in a seated position, you're going to sit on the edge of the chair with kind of the butt cheeks just kind of close to the edge of the chair. And if you're having any sciatic nerve pain, let's say I'm having it in my left leg, all I want you to do is straighten your leg until you feel just a gentle stretch. If you don't feel a stretch there, what I want you to do is lean forward at the hip. That should create some tension on the back side. And then all you're going to do is turn your toes in and back out. Turn your toes in and back out. And that's an easy way to continue to mobilize your nerves as you're traveling. If you're sitting in a car, airplane, train, but 10 times each side. This third stretch works on 2 levels. Simultaneously, the isometric press and release pattern uses a principle called proprioceptive neuromuscular facilitation, PNF, to achieve greater hippoductor muscle length than passive stretching alone. The isometric contraction followed by relaxation creates a reflex inhibition of the muscle that allows it to release to a greater length than it would release to with passive stretch alone. This PNF technique is used in professional physiotherapy settings and produces measurably greater muscle lengthening than standard passive stretching, and in a chair with equipment in under 3 minutes. The knee extension movement during the 60-second hold is the nerve mobilization component, the same sciatic nerve slider Principle used in clinical physiotherapy adapted for the chair. Position as the knee extends and the toes pull toward the shin, the sciatic. Stretch #2, seated psoas release. Nerve slides through its pathway, mobilizing it gently, reducing any adhesions that have formed from chronic compression and restoring the nerve. Excursion that chronic sciatica progressively limits this gentle nerve. Mobilization in the final stretch after the pura pephoris and so have already released means the nerve is being mobilized in a tissue environment that is already less compressed than it was 5 minutes earlier. The effect is cumulative and significantly more powerful than nerve mobilization performed without the preceding muscle releases. You're complete. Protocol: perform all 3 stretches in this exact sequence every single day, ideally twice daily, morning and evening, in any chair that is available to you. The sequence is not arbitrary. Night, the pura pephoris releases the outer compression on the nerve first. The SOIS releases the anterior spinal compression. Second, improving the mechanical environment. The nerve exits through the adductor release with nerve mobilization. Third, using the tissue freedom created by the first 2 stretches to mobilize the nerve through a pathway that is already more open than when you began. Total time, approximately 7 minutes for the complete sequence. No floor, no mat, no getting up and down, just a chair and 7 minutes of consistent daily practice. Give the protocol 2 weeks of absolutely consistent daily practice before evaluating your results. The pura pephoris release typically produces the fastest response. Most seniors notice the first meaningful change in buttock and leg pain character within the first 3 to 5 days. The SOS release produces a slower but deeper change. The aching lumbar quality of sciatica typically beginning to reduce in week 2 as the anterior spinal compression from so tightness progressively decreases. The nerve mobilization effects compound progressively throughout both weeks, restoring nerve excursion day by day as the adhesion breaking effect of consistent daily nerve sliding accumulates. Track your pain score every morning the moment you get out of bed before movement loosens things up. Rate it 1 to 10. Write it down. The consistent downward trend over 2 weeks is the evidence that the chair protocol is working. Not any single day, but the overall trajectory. The patient, from our story, sat in a chair and did these 3 stretches every single day. No floor, no mat, no equipment beyond the kitchen chair they performed them in. Every morning before breakfast. 6 weeks. Pain from 5 to 2. 5. The barrier that had stopped their exercise program for months was gone. And with the barrier gone, the consistency finally became possible. And with the consistency, The results finally came. Your chair is enough. Your 5 minutes is enough. Your commitment to doing this every single day is enough. Starting today. Now, before you go, drop a comment right now. Tell me your age and your city, and tell me, have you been avoiding sciatica exercises because getting on the floor is too difficult? Which of these 3 stretches are you going to try right now in the chair you are sitting in? I read every single comment personally. Share this with someone whose sciatica has been getting worse because floor exercises have become too difficult. Subscribe and turn on notifications because every week this channel brings you something equally practical and equally accessible. 3. Stretches, 1 chair, 7 minutes starting right now. This video is for educational purposes only and is not medical advice. All patient stories have been changed to protect privacy. Individual results vary. Stop any stretch immediately if it produces sharp or worsening pain. These stretches are not appropriate for all sciatica conditions, particularly those involving recent hip surgery, hip replacement, or severe spinal instability. Always consult your healthcare provider before starting any new exercise. Protocol. Dr. Michael Kent is a senior health educator with 20 years of experience. Nothing here is intended to diagnose, treat, cure, or prevent any condition. Viewer discretion advised.